Biochemistry, Genetics Section, Exam 3, Test Block, second lecture. This is discussing chromosome disorders. I break this into a series of lectures. This is the first one. So starting off, chromosome disorders, a couple little random facts that he had bolded. Sex chromosome disorders are typically not seen until puberty. Turner syndrome is the most frequent cause of spontaneous abortions. Polyploidy also is a common, I believe this was like 20%, this was like 15%. And Philadelphia chromosome and CML are also common in that, which has to do with neoplasms, I think, or maybe neoplasms is another common one. Anyway, essentially abnormal numbers of chromosomes is the first group we're going to talk about here. And there are a couple different types. There's polyploidy. Polyploidy basically means you have multiple. So in this case, it'd be triploidy, which would be, a person would have 69 chromosomes. And then there would be, and you think about that, tri-3, so this would be multiples of 3, so this would be 2 multiples of 3 and 3 multiples of 3, maybe that'd be a way of memorizing. And there's also tetraploidy. In this case, they have 92 chromosomes. There's also aneuploidy. So aneuploidy is basically a situation where a person is either has an extra chromosome or they're missing a chromosome. So it might be an individual that has maybe 47 or maybe 45 or 47 individual chromosomes. Typically, if in aneuploidy, if it's just a duplication of the sex chromosomes, then it's often viable. But if it's a duplication of the autosomal chromosomes, which means the other 44 chromosomes, whatever, then it's often lethal. Some examples, though, of ones that aren't always lethal immediately would be Down syndrome, which is a duplication of chromosome 21, Edwards syndrome, which is a duplication of chromosome 18, and Patau syndrome, chromosome 13. Down syndrome, people with Down syndrome often have a simian crease, duodenal atresia, Hirschsprung's disease, mental retardation, lymphoblastic leukemia, those kinds of things. Edwards syndrome, they often have micrognathia, which is a small jaw, a prominent occiput, rocker bottom feet, and things like that. Patau syndrome, they'll often have holoprosencephaly, polydactyly, heart defects, things of that nature. Going over here now to these multiplications of sex chromosomes, there's one called triple X, where essentially someone has 3 X chromosomes, so they'd have a total of 47 chromosomes. They're often tall and thin, and he bolded mosaics under that as well. If a person has an XXY chromosome, so they have 2 female and 1 male, I believe that's Klinefelter syndrome. If a person is XYY, they call it XYY syndrome, and they'd have 47 chromosomes, of course. And that's often seen. People will have, they will be fertile, but they will have ADHD oftentimes. And then a person with XXXX tetrasomy, 48 chromosomes. There's also can be people that have XXXXX, 49 chromosomes, or a person that has an X0 or just an X, and that's called Turner syndrome. Okay, now going into some of the more common ones here. There is, I made some silly pictures to encode the information in ways that we could remember it. Maybe I'll bring this up a little bit closer and move it around as we talk about the different ones. So this first one here, Cri-du-chat syndrome. It stands for cry of a cat. They often have this very distinct cry until they're about 2 years old. And in this case, it's often found in females, and it'll be in the short arm of chromosome 5. So I drew here a cat, a girl cat, it's a female cat. I should probably draw eyelashes so you know it's a girl, right? So there it is, a girl cat. And this cat has a really short arm. There's some lipstick. Has a really short arm and it's trying to give you a high five with its really short arm. So you can recognize that. Next, Williams syndrome. They often describe this as people with elfin features. It's the long arm of chromosome 7. So here's an elf And you can tell he's elf because he's got elf ears, of course, right? Very nice drawing. He has dental abnormalities, so I drew him with some pretty messed up teeth because they usually have hypercalcemia or something like that. He's saying he's 7 years old, so it's on chromosome 7. He's holding a bunch of elastic rubber bands, which stands for the elastin. And his heart has stenosis in there, so maybe his name is Sten or Stan or something, so remember stenosis. Okay, now going down to this one here. This is Wolff-Hirschhorn syndrome. So I drew a picture of a wolf. They often describe the facial features as the appearance of a Greek helmet. So this wolf is wearing a Greek helmet. That's what that is, in case you can't tell. It's on the 4th chromosome. If you notice, this wolf only has 4 teeth. So that's the 4th chromosome. He also has a cleft lip there. That's my attempt to draw that. And this has to do with MSX1, transcription repressor. So a defect MSX. So I was trying to think maybe it's sort of messed, or it's missing some skin there. That's a cleft palate. MSX1. I don't know. So then it also has a defect with LETM1, so it kind of looks like let me almost. So I thought, and that's a mitochondrial calcium and hydrogen antiporter. So I thought of, I'm saying LETM1, let me drink milk with calcium, LETM1, calcium transporter. And then M1 kind of like mitochondrial. Then you've got the WHSC1, which is for histone methyltransferase. So I was thinking of maybe he was kicked out of Washington High School Camp 1 for using stone meth. Okay, so he was using stone meth, so he got kicked out of Washington High School for histone methyltransformation, whatever. Okay, so now going up here, talking about velocardial facial, also known as George syndrome, or maybe you combine the two here. I'm not really sure what he did with this, but he says velocardial facial and George syndrome. Apparently that's the most common microdeletion syndrome. It's a deletion of 22, so I did 2 things, remember 22. One, I have him wearing a tutu, so 22. And also he is 22, and for his 22nd birthday, he got the Xbox One, or TVX One, okay? So we got an Xbox, and somehow a transcription factor. I tried to tell that Xbox One transcription factor. Maybe you can use your Xbox as a transcriber. I'm not really sure. So some issues with this. I drew his thymus was kind of messed up on here. So it's poor thymus development. Also heart defects as well. So I drew kind of a messed up heart. And this is his nose. I drew a large nose here because they have like a long bridge of their nose. And also I drew a glass of milk here that is losing its milk that he's holding, and it's dripping on his Xbox, and that's because they have decreased serum calcium levels.